do you have appointment with me? Yes. So what is your name? Okay. Okay. I do not know the spelling this name, so I do not see how to spell your name, please. Okay. Okay, yes. I am seeing this. You have appointment, yes, with me because I am substitute for Dr. Amanda. Okay. Okay, good. Is this okay? Okay, yes. We leave voicemail on your telephone for letting you know, but I know is sometimes you're not looking at what the voicemail. Okay, so is your schedule full fiscal? Yes. Okay. Perfect. Okay. Yes. So let's get started with some quick question. What is your date of birth? Okay, what year is this? Okay. What is name your insurance company? Yes, and the provider is? Okay, do you have this card with you today? The card for... Yes, insurance, okay. Can I please take for scanning? Okay, thank you. There you go. Okay. Looks good for me. And do you having identification on you? Okay, perfect. Can I see this, please? Thank you. Yes, matching. Yes, good. Okay. Great. All right. Let's starting with take some measure of your height. Okay. I have a simple fabric measure tape here. Oh, nice, got a note. Okay, so stand much very straight for me, and also can you taking off your shoes, please? Okay, yes, great, taking off your shoes. All right, now stand much straight up with your shoulder back like this. Okay. Okay, this looking much perfect. Okay, now we are not having a step on scale today, but can you please saying me you approximate weight? Do you know this? Yes, okay, you know. Okay, that is similar last visit, or... Okay, great. All right, so I should explain something for you first. Okay, unfortunately the computer system is not function properly, so is not fully up to that anymore. It's especially difficult because I am not the typical, you not see me typical, I am substituting, while Dr. Amanda is on leave for pregnancy, okay? Even if these are things that already... So I'm going to ask you much question just to understand what I am looking for, who I am working with. Okay, I'm sorry if this inconvenience you. I hope you not in too much of a hurry. Let me know if there anything you do not know the answer for, and also if there anything that making you a little uncomfortable, then just tell me. It's my priority to make sure you are well and okay. Okay, the first question to ask is what is your biological sex and your preferred pronoun? Okay, yes. If there are anything I ask that is uncomfortable with you, I understand this. I am not the doctor you are familiar with the most, but it's do helping me get be very thorough with your exam if you answer the question honestly. So I suggest you can, but it's okay if you're not wanting answer. Okay. Alright. So what is your occupation? Okay, and then this puts you in any physical danger or labor. Okay. Okay. What is your marital status? Is or you're single, domestic partner, married, divorced? What is? Okay. Okay. Does you knowing what your blood type? Do not know. Okay. We already be taking some blood panel from you, so is no biggie if you want to know also to blood type. You want me to do this for you? Okay, perfect. Now what is your ethnicity? Okay, these are the choice. Asian, white, Native American, Native Hawaiian, okay, African American, Hispanic, or other. Please specify. Okay. Easy. Okay, so what is the address which you are currently housed at? Okay, the spelling, the street name. Yes, okay. Okay, and what is a good phone number for us reaching you? Okay. What pharmacy is you use? Okay, this on the street for what you live, yes? Okay. Everything we are talking here is completely confidential. However, is there any contact with which you like to permit to share your medical records if a request? Okay, yes. First, last name and phone number plus a relation to you. Please and thank you. Is your mother okay? Okay. Anyone else? Okay. Okay. Next is similar question. Who would you like to make your emergency contact? Okay. Okay, same phone number. Good. Yes. Is there any other way in which we can reach out to your emergency contact? Any secondary phone number or something for which if we cannot reach them? Okay. It's a work number? Okay, good. Perfect. Now I will reading list of illness and disease. Illness and disease. And I want you to tell me if you ever experienced this in the past. Okay. Influenza, chickenpox, the measles. Measles. Okay, mumps. Whooping cough. Okay. Tuberculosis. Hepatitis. Diabetes. Asthma. Okay. From that initial diagnosis of your illness, ever return you? Okay. And is you actively experience any of these things that I list? Okay, perfect. And now you can list the medication which you are currently prescribing. Okay. Okay, yes, I'm still taking this. Okay. What is dosage of that? Okay. So it not change from much long ago when effort prescribed, because it's still in system as you say. Okay. Have you ever suffered a fracture or sprain of a muscle or bone? Okay. Have you had any major surgery or procedure before? Okay, when was this? Okay. Do you having any allergy? Okay, allergy. I will list chronic disease and condition, and you tell me, is there any person in the family who are diagnosed with? This can be alive or disease. This can be great grandma. As much as knowledge as you have, it will be much helpful for us. Okay, so diabetes, heart disease, yes, heart disease, heart attack. Is this thing related, but is possible without the disease? Okay. Hypertension. Okay. Yeah. Asthma. Okay. Any history of thyroid disease? Okay. How about genetic or congenital disabilities? Is there any of this in your family? Okay. Fantastic. This the finish of the questionnaire. That means we can begin with your actual physical the exam portion. Okay, thank you so much for your patience. In terms of the tedious questions, I am also very frustrated with the issue with our system, but thank you so much for answering all these things for me. The first actual portion of this exam, I listen to your heart and to your lung. Okay, So first I listen and to breathe total normal breathe, okay? Here we go. Good. Very nice, okay. Good. Okay, good. Okay. 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 Now I am saying to you when you inhale or exhale, okay? Here we go. Okay. Deep breath in. Good. And out. Okay. Deep breath in, please. And out. Good. Deep breath in. Exhale. Okay. Deep breath in. And out. Okay, now I want to take big sharp breaths. Comes out like Rick. Okay, 1, 2, 3. Good. Okay, I put around this side. Okay, one more sharp breaths. Ready? 1, 2, 3. Okay. Excellent. Now let's taking your temperature. Okay. I am just going pull your hair and glide this just like this. Okay, another time please. Okay, just one more. Okay, this not look accurate to me, so we are going to use instead a oral thermometer. Let me sanitize this first, like. Okay. Now, if you please open your mouth, I put this under your tongue. Okay, great. You know what? Yes, just hold it there in your mouth under your tongue. See it a bit slow, but it'll be more accurate. Okay, yes, this seems more correct. Okay, from this point forward, I'm going to continue with the exam, but wearing gloves is for sanitary purpose. So let us start with me. Just take a quick look in your ear, nose and mouth. Okay, just with using the slides. I'm only looking without the touch. Okay, so I just click this on. And now if you can please open your mouth for me like Good, yes. Okay, I use some stick to pushing your tongue, okay, so I can see further to more thing in your throat, okay. So say put your tongue out. Okay, good. So now I want to tilt your head up and back, and I taking a look in your noses. This one is okay. Yes. Okay, good. You're putting your head normal now. Okay. Now I look your ears. Use this thing here and my light. Okay. So if you can just turn your head for this side. Thank you. Okay, this other ear for me. Okay. Good. Now let me put these down for my knots. Okay. Everything looks very good so far. Okay. So. For next portion, I use my fingers for feel certain points on your face and neck area. It's going to be checking for lymphatic system as well as your sinuses. Okay, so just let me push. Okay, just pushing. Okay, pushing and this. Okay, looking okay so far. Okay. Okay. I will put pressure on certain points now and tell me if this causes you any pain. Okay. I take my thumb like this and push. Does you feel any pain from the pressure? No? Okay. How about this? Okay. How about down here under your chin? Okay. Good. This looking so far perfect. But now we're going to take a closer look in your eye. Okay. I will using this shirt here to testing your eye. Okay. I want to tell me from this point which line here is the smallest line you can read comfortably. Okay, this line 1, 2, 3, line 4, 5, 6, 7, 8, 9. Which line from 1 to 9? What is the smallest line you can read comfortably? Okay, go ahead and read this for me. Good. Yes. Correct. Okay, very good. Now I'm push you a little for read this smallest line here. Okay. Just take a guess if you're not sure. Just do your best and I will write down how you do. Alright? Okay, so just go ahead and read from the left side, the right side, the most tiniest line. Okay. Good. Now I'm going to take a closer look in your eye by just have you look at my pen. Okay, my pen right here, and I use this light to look. Okay, don't be scared for blink. It's okay you blink. I just need take a look. Very good. Look without you move. where your eye focus, okay? Okay, very good. Okay, now I move this pen and keep focus on it, please. Okay, good. Okay, now I will shine this light, continue shine this light on your eye. And I still want you to follow where the pen moving, okay, in your line of vision. Are you ready? Okay, here we go. Follow the pen around your line of vision. Okay. Yes, just keep follow the pen. Even if you need to blink if your eyes water, this okay, it's normal. It's totally normal. Good. Just follow it the best you can. Very good. Okay. Now do something very similar. I want to look right there at my nose. And now don't look away from the nose best you can, okay? Yes, just focus on my nose, please. The tippy point of the nose. Very good. Excellent. Okay, now I wanted to follow my fingers. I use a set like this, 2 fingers, as they move across your vision, okay? Ready? Fix your eye on the fingers. Now we begin, okay? It's moving across your line of vision, much like slowly and carefully. Just focus on it. You do very good so far. Okay. Good. Very good. And let me try this. Okay. Now I will use 2 fingers from different hand. I want to pick 1 finger. They move together sometime. Now sometime they break. Together they break. But you need to focus only on the finger you pick, okay? So I have my finger here. Please pick which finger you planning follow. Okay? Good. Let's start them moving. Doing very good. Very good. One more testing UI. I want to show you a card. This card will have picture on it. Okay. I will cover one UI, then I will cover the next UI. I want to say which eye covering make you seeing better versus which eye covering make it more blurry. Okay, here we go. I'm going to cover this eye to begin. Look at the card. Okay. Okay, I do it again just to double check that you have accurate decision. Okay. Good. Where did I put my pen? Okay. Yes. The next portion, I plan to test your ears more further. Okay, I use the light for look in your ears, but now we test the hearing. I'm going to use both hands. I put them on one side, the other side, left, right side. I'm going to make a little thing with my fingers. It's going here like this. If you hear this thing, okay, that's what it's going here like. I put my hands, and you tell me, just use a little point, or you say right, left, either thing is working. You tell me which side make the little. Okay, ready, begin. Which side? Okay. Which side? Very good. Good. Mm-hmm. 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 Okay. I write this on my notes. Okay. Good. Now, there is something I am not so sure with about you here. I think it is okay. I want to get a more closer look to check everything out. I look with the standard light. This pen I use on this, but I prefer to look a little closer just to make sure everything function how it's going supposed to. It is looking like this. It look a little pokey, but it will not touch the inside your ear. Okay, it's looking like this. Okay, it use a light for me see extreme precise what is your ear looking like. Okay, so I mostly want to check on this ear here, but I also take a quick peek at other ear. Do not move your head too much because it might feel light brush on the tube of your ear. Okay, let's looking. Okay, now this. Okay, one more look at this one because it's looking something a little different about this. Just holding still. Good. Thank you. Okay. It seemed me that it's nothing big concern. Just something we keep an eye for future. I read a little note for to Dr. Amanda, so she is aware when you see her next. Okay, you do very good so far. So I am understanding you have had a concern about something going on with your brain. Okay, not a mental, but you say you more have like spells, yes? Okay, yes, so I have put in ahead of time that I want to give you a EEG. Okay, do you know what this is? Alright, it's a way for me looking at what's your brain signal sending. Now it will not go, it's not a procedure, it's a scan, not like x-ray, not like a CAT scan. Is I put little sticker, just sticker on your head, the back, your forehead, and then I ask you to do some simple task for me. Very simple, some breathing task, other thing like this. And I will use the data for read it and make sure everything is functioning okay. If you don't mind, I'm going to pull back your hair and make some quick mark on which part we're going to put the sticky. Okay. Just from that to this perka. Okay, just this point here, this point over there, just down it like so. Okay. This doesn't seem even to me. Okay, does it like here? Okay. Now I take out my machine. See, it's not nothing scary. It's just little thing that show what the energy your brain is making. These are for testing. This episode are not something so a sign something bigger. Okay. It may be tiny itchy because you know is something stuck on your skin. First I want to sanitize the forehead, make sure that no any natural oil must be removed for this to stick. Okay, now just sticking this here to scalp. Okay, right on the point there. Now let's move this. Is crooked. Okay, yes. And just one more of the sticky before we plug, and I just do the test very quick. Okay. Okay. Now I'm going for plug this into the machine. And now I have you do some simple thing. Okay? The first thing I want you, it sounds silly, blink. Okay, I'm going to count back from 20. When I am counting back until I get 0, I want to blink, blink, blink as fast you can. Okay. So, do you understand this? Is it making clear for you? Okay, good. Okay. Go. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Very good. You can stop blink. I know your eyes probably very water. I'm going to give you tissue, okay? Go ahead. You can use this for wipe. Okay. Okay. Now for different kind blink. Except you not blink the light way blink. I wanting you just close your eyes. It feel good for your eyes to more relax after you go blink, blink, blink. But it's very simple. Just close your eyes while I flash this on, off, this light. It will be bright, you see a little through your eyelid. But just close your eyes and relax. Okay, ready? And begin. Perfect. Now, one more final thing for the machine. I want you to breathe in and out as I say. But understand, it's going to get very fast. Like in, out. Like this. Okay? We're going to do it together. Just copy me, and it will go perfect. I will get everything I need from your brain for the machine. Okay, here we go. And in, out, 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 in, out. You feel I did it? Okay, this is normal. That's what we are trying to actually do for getting good look at what your brain reacts like, okay? So don't worry, you can breathe normal. Okay, so this is thing we can't quite fully understand till much later when we get to study closer the result. So this is something, if we spot anything of concern, we have someone call you and let you know. So let me remove this sticky from you. I use a bit of gauze with is acetone, okay, but don't worry, it will not hurt. It's for remove the adhesive because it's very sticky. Okay, as we remove this. Okay, good. Remove this. Okay. Remove. Good. Perfect. And finally one more sticky. We just going pull this and rub. Thank you. You do excellent job for this. The next portion, much more simple. We will testing your nerve on your face. Okay, we want to check that they are sensing and how they feel sensation. I'm going to use tool with a pucky end and a soft end. Okay, one side pucky, the other side more brush like soft. Okay, then which each thing I ask you is sharp or dull, and you tell me. Okay, start very simple with brush where both sides very different. The pucky side very pucky, but it will not hurt. Okay, close your eyes. Sharp or dull? Good. Sharp or dull? Very good. Sharp or dull? Good. Perfect. Thank you so much. Okay. Now I use a different tool. Now the sharp side this tool is much less sharp, and the dull side this tool is more stiff, so it's a little more hard for the difference to seem clear. Okay, close your eyes please. First I do short little drag across your face. Okay, like sharp or dull? Sharp or dull? Okay. Sharp or dull? Sharp or dull? Good. Sharp or dull? Okay. Sharp or dull? Okay. Good. Thank you. To finish this physical exam, we take some quick testing from you. Okay, I'm going to swab your mouth, swab your nose, going to take some blood. Not worry, it will be very painless. I'm going to give you your vaccine before you leave here. Do you want your vaccine today? Okay, perfect. Yes, it will be covered with your insurance if you use vaccine in your physical. First thing, I'm use a swab. I put it lightly, brush around your nose and your other nose. I use one side for one nose, one side for other nose. Okay. So just look, it might go, make your eyes a little more water like, but it will not hurt. Okay, so tip your head. Thank you. Okay. Swab this, send it out for test, and use this for. Okay, put this away for send. I'm going to use the tongue press again, like this. For get the very back of your throat, a swab. Sorry. Okay. Say with your tongue out like Okay, very good. This. Okay, all done. It's very simple like this. Going to tie your arm. So which arm do you prefer? Okay. I will tie top. Okay. We want it to be tight but not painful. Okay. And I will use a needle for taking some blood, not too much, and the needle very tiny. Look, it look like this. It's so tiny. Okay, red, and here with that's it. It's simple like this. I will give you a band-aid for covering it. Okay, good. Now I can keep this very quick and use the same arm for your vaccine if you want. Okay, so all I do is I just remove the tourniquet from your arm. Okay, just take that right off. Very good. And going to take shot in this arm. Okay, so ready? Do you want me count? Okay, 3, 2, 1. Perfect. See, not so bad. I know some patients are a bit scared of this, but it's no big deal. It's no big deal, really. Sorry, there's no blood coming, so. Perfect. Sorry, we do not have Spider-Man or Dora the Explorer, a band-aid for you. Just some normal Walgreen band-aid. And this is it. Very good job. Now you have your vaccine for working or school. I can have a copy of this record for your workplace or anything you might need for emailed to you or print and send you on your way with it or both. Okay, perfect. So I'm just going to take some quick notes. Okay. Everything is looking in extremely good shape. I have a bit of concern about the spell you're having, but I will call you when we have a look very close at the result of your EEG. Anything else you need from me? You need any prescription refilling or? Okay. And I am just going to ask you that you place where ear protection is at concerts or very loud places. I ask that you not play your music too loud with your earbuds, just because I'm seeing some early signs of sensitivity with your hearing. So I want to take care of yourself. Make sure that you hear full colors for very long, okay? Okay. Anything else I can help you today? Nothing? Okay. Very good. You are a very easy patient in this physical. I think overall, yes. Very well. Thank you so much for coming in today. I'm sorry that Dr. Amanda is not in currently, but you know, doctors have life too. So I am feeling her spot for now, and I appreciate your acceptance of me. Thank you. Have a good rest of your day. Stay well, and I will send you all of those results and records when they're ready. Okay. Bye-bye. Thank you so much for watching this video. I want to give special shout out to members, specific my second tier members whose name are going beyond the screen. Okay? Check them out. Check these members out. They're very nice people. I love them. Okay, also I'm going to ask if you can please just hit this subscribe. This subscribe button is so simple. Just click, just puck that subscribe button. Okay? And really guys, I really do appreciate you